Welcome back. Thanks for joining me. We've covered a lot already, but we have so much more to talk about. And, I kind of wanted to put this at the top of the hour, but really didn't have a chance to do that. So much else I had already planned to discuss. But Governor Pritzker signing the assisted suicide bill on Friday on the Feast of Our Lady of Guadalupe, who is known to be the patron saint of not just the Americas, but also the unborn, the marginalized, and the oppressed. Well, if you're at the state where you think that you need to kill yourself because you're a burden to somebody else or you're in pain and you can't get the palliative care that you need, guess what? You're oppressed and maybe you need somebody like a patron saint to look after you and help you through your struggles. But, the assisted suicide bill is just a disaster. It's been a disaster in Canada. I think most famously, Glenn Beck just essentially decided that he would bring a woman down for surgery in the United States, pay for it in his own way, because her only other option to get rid of the pain, because she needed another surgery, was instead they offered her assisted suicide in Canada, when all she probably needs is just another surgery to make her feel better. Is that really where we are? Is that where we're going? Is that where we're going as a state? Well, one of the lead people on the Republican side who argued against this bill is Dr. Bill Hauter, state representative. He joins me right now. Thank you so much for joining me on The Real Story, Bill.
Hey, Jean. I hadn't heard that story of Glenn Beck doing that. That's very interesting. I have to look that up.
Oh, yeah. The story just came out like 2 or 3 days ago, and it just tells you where Canada is. And in fact, they're moving towards letting minors actually choose assisted suicide. Now,
absolutely, it's out of control what's going on in Canada, but everywhere it's been tried, Jeannie, everywhere it's been tried, it expands exponentially. So when they said, and they repeatedly assured us that this was going to be, well-controlled, tight boundaries, strict criteria, and we laughed because this is the way they introduced a Trojan horse in all these different areas, whether we're talking about marijuana or, you can go example after example. Oh, we're only going to do it for this, but it quickly and everywhere expands. The evidence is totally clear that this is just the way they introduce it, and then they expand it.
Yeah, so it's not unlike abortion, let's face it, and it's interesting that the New York Times did a feature story on Carbondale, which is a sleepy little college town, population 21,000, and yet 11,000 elective abortions are done in this small little town in the state of Illinois since Pritzker expanded his abortion tourism and support for it. And it's going to be the same thing. We have a death culture in the state of Illinois, and we're going to now be a destination for assisted suicide. At least that's how I read it. What say you?
I totally agree, and it's become very clear to me that we have a culture of death in Illinois, and it's really made me. I have grief. That's the only way I can say it, because as a physician, I'm the only physician in the Illinois General Assembly. And so I just want to make sure that your listeners are aware that the Illinois State Medical Society, which is, not a pro-life organization, but it does represent the Illinois physicians. It's the largest advocacy group for physicians in Illinois across the state. We stand strongly opposed to physician-assisted suicide. And once more, Jeannie, they constantly said medical aid in dying, to use these euphemisms for physician-assisted suicide. And I repeatedly refuse to, and the Illinois State Medical Society refuses to call it anything other than physician-assisted suicide, because that's what it is. And they constantly try to control the language that we use. We see this all over. And, whatever they want to control the argument, they try to control the language first. But,
like Safety Act?
Yeah, exactly. Yeah. They or your correct pronouns, or, whatever they do, they try to control the language. Well, they try to control the language by continually calling this medical aid in dying. We have in medicine already medical aid in dying. It's called hospice care. And we also have palliative care, which we've devoted great resources to to expand our care of those who have chronic illnesses or chronic disabilities, how to improve their lives, how to make their lives more fulfilling and useful, and so not just throwing them away, but making people with those with disabilities or feel marginalized in some way or with chronic pain, that we can address that. And then if their prognosis is so poor, they go into hospice care. And so we have hospice care to take care of those who are in the dying process. And so we have medical aid in dying, and we've had it for a long time. And the state just disregarded that and now has made a way for certain physicians. And as you know, there's always some bad actors. I'm just going to say bad actors who will now have a license to participate in physicians assisting people in killing themselves. And those people will now have, the ability to do that. I think many physicians will, of course, not take any part of it. And again, also pharmacists have to take part in this because this is medication, a lot of medication that will be dispensed by a pharmacy. And so you have to have two physicians and you have to have a pharmacy that all agree to give you these dozens and dozens of pills to take home. So there's always that safety question. I mean, there's so many questions with this.
Right. Yeah, so you can actually, you decide where and when you want to take it. That includes you can go ahead and take the pills at home. Well, you could also just be leaving them lying around for somebody to ingest who does it accidentally.
Absolutely. There's great concerns about many people, will think, I'll just get it just in case. And then they'll get these dozens of sedatives and cardiac drugs and that they're supposed to all take at the same time. There's no requirement for any kind of medical person or professional to be involved in this other than prescribing it and dispensing it. Then you can do whatever you want with it, including selling it. I don't think, that will be a big part of it, but we'll have these, dozens and dozens of drugs that we're going to give somebody that will be a safety risk, also something nefarious with it. So it's just, there's so many reasons to oppose this, but from my angle, the medical society, physicians were outspoken against this. Even the AMA, the liberal organization that the AMA is, still opposes physicians being involved. We're supposed to be healers. We're supposed to be compassionate people that try to relieve suffering and try to meet people's needs, not to kill them. Our ancient and sacred oath that is so important to us, that says, first, do no harm. This is totally incompatible with the oath that we have taken, and it will totally change the soul of Illinois medicine.
Okay, I want to ask you about one more thing. And it says the Thomas More Society vowed to defend the rights of conscience of medical professions from referring for assisted suicide, which the new law requires. They explained, and I'm reading from an email, beyond the tragedy of state-endorsed suicide, the law compounds its moral failure by attacking the conscious rights of healthcare providers. It now requires physicians who object to assisted suicide on moral or religious grounds to refer patients to providers who will participate in ending their lives. The state is forcing doctors to become active participants and cooperators in a patient's suicide, no matter if their faith, ethics, or Hippocratic oath forbid it. This is unconscionable coercion, plain and simple. No doctor should be ordered by the government to participate directly or indirectly in the process that deliberately ends a human life. And then they go on to say it looks like they're going to be filing a lawsuit, which is great because they also were the ones who filed that lawsuit when they decided that pro-life pregnancy centers had to refer for abortion. And that was a foolish law signed by Republican Governor Rauner. Now you've got this one even more foolish, referring for death, referring for suicide. I thought we had suicide hotlines that we paid for. Oh, by the way.
Yeah. I mean, they're so two-minded and hypocritical about this issue. But, you're 100% right. I agree with the Thomas More Society, which has been instrumental in so many battles in Illinois, but for life in Illinois. But I will say that this will definitely be litigated because they can't compel our speech. They can't compel us to do things. They can't compel our speech. Just like in the pregnancy centers, they lost repeatedly all over the place. Every time they lose. But Jeannie, the process is the punishment here in Illinois. They don't care about litigation at the Supreme Court. It's not their money or time. So they make these laws, and then we have to take them to court and win. But it's not. They can campaign that they did this. It's the same thing with the pregnancy centers. My wife's heavily involved with a pregnancy center and has been for years and years. And so we've been through these battles. They cannot compel the speech, but they continue to make these laws, and they'll lose.
Yep. Well, that's Illinois. You're right. The process is the punishment. It's to force you to pay money, whether it's gun laws, these laws, abortion, you name it.
Yep.
You have to do what they say. COVID laws, you name it, all that. This is tyranny to the utmost. This is a new level of lowness, though, and we have created a death culture here in the state of Illinois. I just hope people wake up from it. Dr. Bill Hauter, state representative, thank you so much for joining me on The Real Story. I really appreciate your insight and your fight.
Always like coming on. Thank you for having me, Jeannie.
You bet. And we'll be right back.